Greetings all. I am Dr. Bhavin, Vascular and Endovascular Surgeon at Yashoda Hospital, Secunderabad. Diabetic foot is a wound or ulcer on the foot in diabetic patients. In diabetic patient, because of lack of sensation, they are more prone to develop any ulcer and it can get infected, which can convert into diabetic foot infection. In diabetic foot, normally patient will be having ulcer, redness, swelling, more than usual pain. More or less, it is kind of any ulcer on the leg. It should be termed as a diabetic foot ulcer. So this center we have opened particularly to help the diabetic patients to prevent this kind of diabetic foot wound, and sometimes all this diabetic foot can develop major infection, and from that amputations like toe amputation or foot amputation also can happen. So this center will help in preventing all this amputation and primarily to treat this diabetic foot ulcers and infections. At this center we are having various kind of diagnostic modalities to see that proper blood circulation is there in the foot or not, how is the diabetic foot sensation, whether any severe or moderate sensory loss is there or not. If it is there, then we are planning to treat such kind of patients at this center only. So in short, you can say that at this center, diabetic patients will get all the available treatment and diagnostic modality. They do not have to roam around here and there for this treatment. In diabetic patient, after 5 to 7 years of diabetes, patient will have lack of sensation. We call it diabetic neuropathy. Because of that, any small leg ulcer also patient will have, but they will not have any pain. Gradually, because of that, they will get infection in that wound. Other than that, ischemia or lack of blood circulation also becomes a major factor in diabetic patients. Over the time, small and medium size of blood vessels or arteries will get calcified and blockage in the circulation will cause diabetic foot ulcer. So in short, diabetic neuropathy, lack of blood circulation and infection, all three together causes diabetic foot infection or ulcer. First thing, for prevention, diabetic neuropathy should be treated or it should be controlled. Other than that, patients should be taking good care of their feet. They should be inspecting their feet daily twice. It should be cleaned properly. They should not be walking barefoot anywhere, inside house or outside. They should be using diabetic footwear. Other than that, proper moisturization of the foot skin, that is the most important part. Sometimes patients try to cut their nail and during that time they can injure their toenails or toe band, which can also convert into diabetic foot infection. Other than that, main aspect is control of sugar, glycemic control and prevention of smoking. If they are using any form of tobacco, they should be stopping that. All these things are very much important factors for diabetic ulcer prevention. Coming to treatment part, as we have already spoken about diabetic neuropathy, lack of blood circulation and infection. All three parts should be treated together, then only diabetic foot ulcer can be prevented or cured. For that diabetic neuropathy, we will be giving the medication and footwear. For ischemia part or lack of blood circulation, we should improve the blood circulation by different modalities like tibial angioplasty, where we go inside the artery, open up the blockages. And third part is infection. For infection, we will give antibiotic, and if required, we can clean the infected portion of the foot. So all three things together are much more important to treat any diabetic foot ulcer or infection. At our Advanced Diabetic Wound Care and Limb Salvage Center, we are having different diagnostic and therapeutic modalities to treat various kind of diabetic foot infection. In diagnostic modalities, we are having different instruments or modalities for diabetic neuropathy, where we can find out that whether patient is having mild, moderate or severe diabetic neuropathy. Other than that, we are having ABI and TBI machine, which checks out the blood circulation of the foot and particularly toes. If any lack of blood circulation is there, we can pick up from this. Other than that, we are having more different modalities to clean the diabetic foot ulcers. Various debriders are available and various dressing material also available. In conclusion, I would like to say that during this COVID era or pandemic time, diabetic patients are much more prone than the normal population. So they should take care of their diabetic or glycemic control very well. And at the same time, they should not neglect their fit also. Better to take care of fit to prevent all these diabetic foot complications. Thank you.